Aaron DERFEL, who joins us from time to time, Montreal Gazette health reporter who's done such a terrific work, of course, back in COVID days, and even now, just taking a look, poking the bear to see what's going on in our healthcare system. Well, something we've not talked a lot about, and that's, we talk Bill 23, Bill C-13, Bill 9, Bill C-15, and Bill 15, which is a provincial bill. This is going to remake our health system. Christian Dubé, with great fanfare, not that many weeks ago, talking about this, saying it's going to be a huge change. I think he said a sea change. He had an actual quote in there. But the government, which has always gone out of its way to tell us nothing changes here as far as, English and access of services in the healthcare system. Well, what they didn't tell us was something else that is in this bill that Aaron wrote about today. Aaron, first of all, welcome back. Good to have you here.
Good afternoon, Aaron and Natasha.
What don't we know that we should be concerned of as Anglos with respect to Bill 15?
Yeah, so this flew under the radar, and nobody realized it until people went over the bill clause by clause. So right now, when there are hospitals across the province, and you have Anglophones who are out in the community who have a direct say in these so-called access plans to ensure that health and social services at a hospital or a clinic are available in English. And if Bill 15 becomes law, and there's every reason that it will be adopted because of majority government, then it's Santé Quebec, this agency that will oversee these access plans. And you're not going to have people on boards from the Anglophone community at these various institutions who will have a direct say in this. And so it just strips away, just more chipping away in terms of access to healthcare in English in Quebec. And it is a serious issue when we're talking about, being able to get a diagnosis in English. People who are older, they revert to their mother tongue, which is, English, 900,000 Anglophones and Allophones in Quebec. So it's a very, very serious issue. It touches on healthcare, and it's quite dispiriting that the government is chipping away at this.
So we know that the government is going to be hearing from a variety of interested parties, as they say. Are any English parties being sought out here or being denied a chance to talk about this?
What I know is, I can't go into details, but there is a, behind-the-scenes diplomatic effort to persuade the local government, in particular Christian Dubé, the health minister, to make amendments to Bill 15 that would safeguard Anglophone rights. But all this, of course, is predicated on Bill 96. And Bill 96, as you know, it stipulates that that all government services automatically, the priority is French. There can be exceptions, in terms of health, if someone has a file in English, to continue with that, and in the case of emergencies. But again, Bill 96, it just further restricts access to healthcare in English. And even prior to this, I had written stories about signage at hospitals that English was vanishing from some walls in hospitals, making it more and more difficult. And you'll recall a few years ago, in his first mandate, Legault refused the pleas of like a dozen towns in the Laurentians asking for bilingual signs. So this is a steady and concerted effort to erode Anglo rights, and I would wager that more than commerce, more than bonjour, hi, that that exchanges in English for healthcare. This is something that it's a human rights issue.
Yeah, that's exactly what I was wondering. It makes me immediately think of what happened with the English school boards, and that there was a challenge on that front. The idea here being that the decisions being made about what's best for Anglophones are not being made by Anglophones. So do you foresee another legal challenge?
Yeah, I could see that happening if the amendments are not being made. And just to sort of put things in perspective so that people understand, sometimes you have these stroke victims. They have to learn how to speak a language. And there have been odd situations where you might have a francophone following a stroke that, for whatever reason, neurologically, they cannot speak French, but they can speak English. And, this is what a rare thing, but I was told about that sort of thing. So, it just really, it's galling. It's absolutely galling that the government is moving in this direction. You'll recall back in 1996, then Premier Lucien Bouchard said, when you go to a hospital, you might need a blood test, but you don't need a language test. So this is really beyond the pale.
Yeah, we have to wrap up, but you also, in your story today, you talk about the fact where, I guess, as one person said, and we hear from people saying they don't believe this still happens, but someone who went and apparently asked for service in English and was told by the person there, I won't serve you in English because that's my right to do that.
Exactly. And you're going to have situations, too, where you're going to have ideologically motivated individuals who are going to overhear, because this happened before, but now they're emboldened by Bill 96. You hear two doctors speaking in English. They say, you're supposed to automatically speak in French. And so they're going to snitch to the Office québécois de la langue française. And under this bill, they have like these unlimited search and seizure powers. They're going to go in, and we might see, you can't rule this out because it happened before. It happened before, long before Bill 96, and it's just a matter of time before we see something like that happen, where a health professional is denounced and reprimanded for having the gall to speak to a colleague in English about a medical issue.
Aaron DERFEL, Montreal Gazette. Aaron, thanks again. Appreciate it.
My pleasure.